My name is Haley Creamer. It's September 30th, and I'm going to be talking about Parkinsonian syndrome, which is a syndrome of the nervous system. So, Parkinson's syndrome encompasses a number of nosologic entities that are grouped together based on their shared conditions of clinical features, such as bradykinesia, difficulty speaking, difficulty swallowing. However, different diseases within Parkinsonian syndrome have different pathophysiologies behind them. Okay, so the general clinical manifestations of Parkinsonian syndrome include bradykinesia, or slow movement, tremors, rigidity, gait disturbance, and dysarthria, or trouble swallowing and chewing. Three syndromes from the nervous system that are different than Parkinsonian syndrome include cerebellar syndrome, or cerebellar ataxia, which is categorized by a degeneration of the neurons in the cerebellum of the brain, or the back end, which controls movement coordination. So walking in cerebellar ataxia patients, you can see the gait is slower and wide-based, and it's unsteady, with truncal and upper limb ataxia giving the appearance of flailing. This is different than in Parkinsonian patients, as I'll explain later. And yeah, cerebellar ataxia is categorized or characterized by degeneration of cells in the cerebellum, rather than in the substantia nigra or in the basal ganglia, as is in Parkinson's disease. Central sensitization is another syndrome that is different than Parkinsonian syndrome, and central sensitization refers to the development and maintenance of chronic pain. So the central nervous system amplifies the sensory input across many different organ systems via increased synaptic efficacy of pain, or nociceptors, throughout the whole body. And so this includes a reduction of inhibition of these pathways. So these pathways are firing way too frequently, meaning patients can feel pain even to things such as light touch or massage, things that generally wouldn't cause pain. Another syndrome is extrapyramidal syndrome. Extrapyramidal syndrome is often classified as a drug-induced movement disorder. Extrapyramidal syndrome is often caused by antipsychotic drugs such as Haldol or D2 dopamine 2 receptor antagonists. These are the opposite of Parkinsonian drugs such as levodopa, which is a D2 receptor agonist. So, D2 receptor antagonists actually cause similar symptoms to Parkinsonian syndromes, such as drooling, difficulty speaking, kind of a lapse or a shrugged appearance, and again, this causes an anti-dopaminergic action in the caudate nucleus and other parts of the limbic system in the human brain. And yeah, so D2 agonists, medication for Parkinsonian syndrome, D2 antagonists give the appearance of other kinds of dyskinesias. Three diseases that are included in Parkinsonian syndrome include Parkinson's disease, maybe the most evident one, also parasupranuclear palsy, or PSP, and in addition, multiple system atrophy, or MSA. Parkinsonian syndrome refers to the degeneration of the dopaminergic neurons in the substantia nigra, which is part of the limbic system of the human brain. And the classic diagnosis for this disease is based off of a couple different signs that a provider may see. These include bradykinesia, a typical resting tremor, extrapyramidal rigidity, postural instability, dysarthria or difficulty swallowing, and a shuffling kind of gait. A lot of times Parkinson's patients, you can tell, because unlike normal walking, where the arm movement opposes the movement of the legs, in Parkinson's patients, their arm movement won't quite go along in that same kind of manner. So that's Parkinson's disease, which is often treated by levodopa or dopamine 2 receptor agonist medications. And patients often take multiple doses of this throughout the day or for a long amount of time in order to help relieve their symptoms. PSA and MSA patients do not respond to levodopa in the same kind of manner due to the different areas of the brain in which there's atrophy. So parasupranuclear palsy is categorized specifically by the gait being a little different. It's instead narrow, the trunk is a little bit more lurched, and the patient can come across like they're flailing. And in parasupranuclear palsy, the patient again does not respond to levodopa or other kind of dopaminergic agonist medications. Multiple system atrophy, or MSA, involves an autonomic, progressive, slow degeneration of multiple different systems of the body. So a lot of times these patients will, at first, early in their prognosis or early in their diagnosis, manifest in things like incontinence or constipation, erectile dysfunction, these kinds of things, and often see a different kind of provider or specialist, such as a urologist, before they actually, down the road, end up getting diagnosed with a nervous system degenerative disorder, such as MSA. So MSA patients will only down the road into their diagnosis eventually be diagnosed with MSA once they see other kinds of signs, such as stimulus-sensitive myotonus, so they respond to different things from the environment rather than having a resting tremor, which is common in Parkinson's patients. However, Parkinson's disease, parasupernuclear palsy, and multiple system atrophy can all be included in the syndrome of Parkinsonian syndrome because they're all movement disorders that all are categorized in the same way. Difficulty walking, bradykinesia, difficulty speaking, all of these symptoms are similar. However, PD, PSP, and MSA patients all respond to medications differently, leading to the different pathophysiologies and pathogenesis between each of these different diagnoses. Thank you for watching my presentation on Parkinsonian syndrome. I hope that you learned a lot. My name is Haley Creamer, and I hope that you enjoyed it. Thank you.